Good afternoon, ladies and gentlemen. It's yet another day, a new day, a bright Sunday, a day that the Lord has made, a day that we have all gathered here to bring live streaming program to you from Richmond Media, Health Issues. Today's program is about diet and stroke. What is stroke? How can we prevent ourselves from getting stroke? What are the recommended diets that will help us to survive even when we get stroke? How can we live when we get stroke? Or how can we prevent ourselves from getting stroke in order to live longer, to enjoy the fruit of our womb, to enjoy life to the most, to enjoy life from what we have toiled for? This program will enlighten us, will explain, will take us to the high level of how to survive in this our modern world from getting stroke. With me at Richmond Media is no other person than my own brother, Mr. Maxwell, OWUSU ANSAH. Brother Maxwell, you're welcome to Richmond Media, where life
Thank you very much.
promoted.
Thank you very much.
You're welcome. Friends and family watching us at this moment from Richmond Media, please stay tuned, call your friend, send a message to your friend to join us at this time so that we can all share what we have from Richmond Media. Don't forget to comment and also to let us know that you are with us. The only way that we can know that you are with us is by sharing your comments, because your comments or your question will be answered, and that will also answer someone's who cannot send a message at this moment, so that the person's question will also be answered and we can all enjoy the program today. My name is Hanna, Bimah, bringing to you health issues from Richmond Media. Thank you so much for keeping watching us at this time. Brother Maxwell, how are you today?
I'm good by God's grace, and I hope yourself as well as our listeners and viewers are all doing good by God's grace.
Thank you. I'm doing great by the same grace that has sustained us up to this time. And we hope that God will continue to protect us and to prevent us and to give us the knowledge and understanding into the topic that we are going to be presenting to the whole world. Because once you come on Richmond Media, you are really coming to the whole world, because everyone is watching us from different country, which bring us all together under one umbrella. Today's topic is about diet and stroke. What is stroke at all, please?
Okay, thank you very much. Stroke is a medical condition, and it is very life-threatening in the sense that it affects the brain, the tissue, the human brain tissue. And then this happens when blood supply to the brain is cut off. You see, the brain controls majorly the activities the body does. So the brain controls the flow of blood, um, and mostly cellular uh, functions or tissue function, and as well as organ function. So the this role that the brain plays becomes affected when the nutrition of the brain uh, comes to a halt, and the food the brain uses is
Brother Luciansa is telling us, explaining what stroke is. Uh, the lack of nutrition to the tissues of the brain. That's what he is saying at the moment. But it looks like the network from his end is a bit, what should I say? It's not really working smoothly for us, but whilst we are still waiting for him to come, we can have a commercial break at the moment. If you are watching us from wherever you are and you are sending money to Ghana, we recommend one company to you. It's OA Pay Community Show. Is the way that you can send money to your friends and family. That's your first transaction, you will get £5 free, and then you will get additional donations as well. So when you send money through Pay Community Shield, um, you will also is a money transfer company that directly send money to Ghana instantly. Your family members, friends can receive it, as well as the whole community if you are sending it to them. So when you are sending it, there is a promotion code that you can use. It's no other code than Richmore. Please don't forget to send money through OA Pay Community Shield. Are you a church or association looking to raise funds for your welfare? Or a pay has a deal for you. Your church, shop, restaurant, or association can get monthly donations from OA Pay if you and other members send money with OA Pay. Members will also get extra £5 on their first transaction, as I told you, and the promotion code, use coupon code RICHMO, or contact us now to get started on the number 044-7960-568-295, and all the information about OAP Community Shield will be cascaded to you. Thank you so much. Keep watching us from Richmond Media, and the topic is diet and stroke health issues. Mr. Oziansa, please continue. Thank you.
okay. So if blood supply to the brain is cut off, then the individual might develop what is medically described as a stroke. And this is very life threatening because when the brain gets affected, mostly the other cells also tend to follow suit. And so it is a medical condition, medical emergency. It needs to be treated urgently. Yeah, and it happens when the blood supply to the brain is cut off.
Thank you so much. So, as you are watching us from wherever you are watching us from, this is Richmond Media, right to your doorsteps. You can also watch us on live on Facebook and live on YouTube. Also streaming live, you can listen to us on a radio called Richmond Media. Don't forget to invite your friends, family, and other community members to join us as we share this important topic, diet and stroke. Mr. Wilson, thank you for giving us the explanation that our blood supply to the brain, if the brain cannot supply blood to the, sorry, if the blood vessels cannot supply blood to the brain, that's when stroke occurs. So if there is no supply to the of blood to the brain, that means the brain tissues are not getting nutrients that will help it to function for us. So in this case, what are the causes? What are the factors that contribute to stroke?
Okay, thank you. Basically, there are two main description of situations that result in stroke. So I would say there are two main types of stroke depending on the cause. Um, there's one that is called ischemic stroke, and then this is mostly common. So most of the cases that are sent to the hospitals um, have this background, and that results when there is a blockade, say maybe a clot in the channels that the blood runs through to the brain. If this happens, there isn't that flow of blood to the brain, so there becomes there's a blockage, yeah, to uh, that the blood could get to the brain, and so that um, causes the receiving end of the brain uh, to be affected, and subsequently the body part that part of the brain also controls also becomes affected. So these blood clots uh, typically form in the areas where the arteries have been narrowed or blocked over time, say by fatty deposits. Yeah, and then it tends to harm the brain so much. And then the other type is called hemorrhagic strokes. That also happens when um, vessels that supply blood to the brain, when they rupture or burst, um, the brain bleeds. Yeah, let me put it that way. The brain bleeds, and then that bleeding can also cause serious harm to the brain tissue. But mostly factors that contribute to any of these types, either of these types, may include those conditions we have already discussed. That is high blood pressure or hypertension, diabetes, and being obese. Obesity can also lead to stroke, and then excessive consumption of alcohol and smoking. And then with the blood vessels in action, if it hardens or maybe it narrows, the lumen of the blood vessels narrows due to high cholesterol levels. These can also or result in stroke. And then if there's a problem with the individual's the heart, say irregular heartbeat, that could also affect the amount and time that blood reaches the brain, and so that can also result in stroke. And then there's this type also. It's mostly not classified amongst either of the already mentioned types. It is also known as transient ischemic attack. Yeah,
Yeah,
and
yeah.
then that also comes about. Um, that is a very self-limiting condition. It comes about when uh, the supply of blood to the brain is affected. But that since that is a self-limiting condition, it is mostly not classified as a major type, as the two I have already mentioned, which is ischemic stroke and then hemorrhagic stroke. Thank you.
Thank you so much. So we usually hears people saying, "I got mini stroke," or "I someone is suffering from mini stroke." That the person is referring to TIA, which
TIA, yeah.
our brother has explained it to us as trans transient ischemic attack.
Yeah.
At this moment, when we hear all this, people usually anyway, we it's here that we usually hear the TIA, but from other parts of the world, they've all got different types of. It's the same name, but due to the different types of languages. The language that is spoken by that country or that city overtakes maybe the English word, so that person will be able to explain it in his or her own dialect that will be more understandable. So when you are coming from other parts of it, we usually don't hear the TIA much often, except the healthcare professionals that usually hears that one. But once you get that TIA, then I think people tend to be scared, or it's like that means I'm going to get either the hemorrhagic or the ischemic itself. That's what people tend to fear about. But all these can be managed when you
Sure.
really take your diet
Sure.
into consideration, that it will not lead to what you might be thinking of, or what you've got in mind, or what you have heard from someone's case, someone's condition, someone who has already gotten themselves into this kind of diseases or conditions. Mr. OWUSU Answer, thank you so much for this in-depth understanding that you are giving to us at this moment. But you cannot get this from anywhere except on Richmond Media. YouTube, Richmond Media, Facebook, Richmond Media, and then you can also listen to us from Richmond Radio, the only station that can bring to you health issues. Mr. Wusiansa, so what age is at risk of getting this kind of? Because mostly when we hear stroke, we think it's the only the elderly ones, but once in a while you hear the younger ones also suffer from this kind of disease or condition. What do you think? What age is at high risk? And how can all age groups be alert?
Okay. So mostly, as we have seen in our um, previous discussions, as one ages, the functions of the human organism, the tissues, the organs, and all the other entities of the human body um, declines in strength, in function. Yeah. So basically, um, the older adult, the older adult is at high risk. Yeah, since the bodily function declines with age. However, there have been cases of children suffering stroke in the UK itself. Um, Research has proven that every year about 400 children in the UK have stroke, according to the UK Stroke Association. So this is very, very serious. Um, we would all expect that the older adults might be affected. However, there have been instances of children suffering this. So I would say we all have to be very, very cautious and mindful of how we live, so as to help us um, live the life that we want to live in terms of health. Because Um, the older adult is at risk, and then children are also at risk.
Thank you so much for this information. Then, if everyone is at risk, how can diet plays a major role in the causes and the management of stroke?
Okay, okay. So since this condition results from um, the shortage or the cessation of blood to the brain. It is a fact, an established fact that the brain tissue, it's a fatty tissue. So in nutrition or in our diet, the elements in the diet that contributes to healthy fat getting into our system plays a major role in helping the individual prevent or manage stroke, since the brain is a fatty tissue. So when it comes to the causes, um, it is mostly related to anything that affects blood supply to the brain. That is what is to be considered when it comes to the causes. And when it comes to the management also, it is related to anything that promotes effective supply of blood to the brain. And then um, healthy fatty elements that gets into the body also help promote. So diet uh, can be considered as solely a very important entity when it comes to stroke and its management. Diet is very important. So I would say you would have to consider taking in healthy fats, that is fats and fatty acids, those that are very healthy, and then refraining from the harmful cholesterols, since they can affect the blood vessels, which send blood to the brain. If it becomes narrow or hardened, there will arise a problem. So, staying away from harmful cholesterol, and then also staying away from substances such as alcohol and then nicotine, since these things harden the blood vessels. You have to stay off those things. And regular exercise is very, very important when it comes to the management of stroke. So I believe all these have to be considered. Thank you.
Thank you so much, Mr. Wusiansan. Let's take a commercial break. I recommend to you the only way to transfer money to Ghana is by OA Pay Community Shield. If you want to transfer money to Ghana, or if you are transferring money to Ghana, please use OA Pay Community Shield. Are you a church or association looking to raise funds for your welfare? OAPay has a deal for you. Your church, shop, restaurant, or association can get monthly donations from OAPay if you and other members send money with OAPay. Our first membership transfer, you will get extra £5. So don't forget to use OAPay Community Shield. The promotion code or the coupon code is RICHMO. Contact us now to get started by contacting us on 0044 or if you are in the UK, you just call on 07960568295, or you can contact us by email on info@oneafrica.io. Thank you so much. You are watching us or viewing us or listening to us From Richmond Media, health issues, diet, and stroke. We are just bringing to you a ways of how to live, how to survive, how to control yourself, control your diet in order not to get stroke. However, if you get it, how can you live longer than you expected to live? Thank you so much. Right with me at the studio from Richmond Media is no other person than my own brother, Mr. OWUSU ANSAH. So please continue to stay tuned. Call your friend, call your family members, ask everyone in your community to join us as we promote health together, we create awareness together, and we can have a longer life because health is life. Mr. OWUSU ANSAH, there is one particular question that I would like to find out as does stress at all contribute to stroke and how?
Okay, thank you very much. In a sense, yes, yes, stress can contribute to the development of stroke. Since when the body is tensed in situations of stress, um, the activities of the heart, the blood vessels, they all heighten in stress. So, if in such an instance, um, the let me say the tension or the pressure involved in the transfer of blood to the brain increases, and there's a problem with any vessel at all, there can be a rupture. There can be a rupture. So the individual can develop the hemorrhagic stroke. In cases of stress, the individual can develop hemorrhagic stroke. And then there have also been instances of um, trauma, severe trauma, that could also result in stroke if the brain tissue is majorly affected. It can result in stroke. Thank you.
Thank you so much. You were earlier on talking about diet and how it contributes to the management and causes of that. Is there any particular food that we can consider from getting stroke or even when we are being attacked by stroke? What are some of the food that you think we can consider that will help us to manage the condition?
Okay, thank you very much. Um, since stroke is related to the heart, the blood, and then the blood vessels, I would start the management or the prevention by saying um, all substances that would cause thickening of the blood, narrowing of the blood vessels, and then blockages, we should refrain from that. And mostly, those are the substances we've been talking about all along: alcohol, um, nicotine containing substances, stimulants, let me put it that way, smoke. We should refrain from all those. And then when it comes to diet, as I've been saying, we should ingest healthy cholesterol, if we would, healthy cholesterol. That's from the animal sources of food. We should ingest healthy cholesterol. So if you would take meat, it should be lean meat, devoid of the harmful cholesterol. And then if it comes to plants or plant sources, the best that I would recommend would be the nuts, the seeds, the grains, and the cereals. And interestingly, those are what we have been using, but we have to consider taking those that have higher quantities of the healthy fats, those that contain the omegas. Um, yes, those are what the individual seeking to prevent himself from getting stroke, or seeking to manage an already um, suffered stroke, should also stick to those kinds of food. I always say I don't mention specific food. I don't bring out specific food substances because we all live in different geographic areas. So whatever is considered as a nut, a seed, a grain, or a cereal in your area, that is good for you. And then fruits and vegetables, those are also very, very, very helpful to take. And as I've said, when it comes to the animal substances, you stay away from the harmful cholesterol. Harmful cholesterol. In effect, if you would take meat, it should be lean, devoid of the harmful cholesterol. Thank you very much.
Thank you so much. Yesterday, I was listening to a program from someone, and like all that you have mentioned were considered. But what a person was saying that, like, when we take, you're talking about the omega. When we take fish, for instance, that fish is good, it can also be harmful. In which way? The person said, when the fish is coming from the sea, no problem with it. But when it comes to the, should I say, the artificial way or the new way of farming activities that we are conducting in this our recent times or our technological moments, because sometimes a small fish can be in the pond. You can introduce the fish into the pond. Within 2 weeks, the fish is like, this fish will be like this. So if you are eating that one and you think you are eating or having a healthy diet, then you have to watch yourself very well. However, from what you have informed us, some people from where we coming from, we grow groundnuts. That's how we were taught. But when we come to this country, we are told it's peanuts. We don't know if they gave us the different English word when we were taught English, and then the English themselves have got a different way of classifying their own things in their way. We find ourselves to have those ones, granules, and nowadays we are having more of cashew and other nuts. But some other countries might not have what we have, but in their own way or own area, they will also have a particular nuts that is being grown depending on the type of soil that they have in their area. So that doesn't mean your one is not good, but when you are eating, how much are you eating? That should also be considered. The amount that you are putting it on your plate. Is it balancing? Are you having a bit of everything that will contribute to the growth of your health? That will give you a long life, that will prevent you from getting stroke. Let's watch out what we eat and what we consider. Mr. Wusiansa, if we
No.
get ourselves, we are doing all this, but we still find ourselves in this type of situation by getting stroke, either it's ischemic, hemorrhagic, or TIA, whatever form it is. We found ourselves in, because sometimes it doesn't matter what you do, you can still be healthy,
Sure.
but you still get yourself into it. If you get that way, you find yourself being managed by medications and diets. What are the dangers of this medication affecting your health? Because you are already being affected by one. And what does these medication that are being given to you to manage the condition add additional effects to what you have already got? What can you say about this? Thank you, Maggie.
Okay, thank you very much. Um, if an individual has suffered stroke and he or she is being managed, all the factors that I have talked about are mostly also considered and included in the person's care plan. So, in terms of diet, the person sees the right um, professional, the right healthcare personnel to deal with that. In terms of exercising, that one too is considered. So, what I would say about um, stroke treatment is that the type of treatment regimen the individual is placed on should be valued, and then whatever comes out of it, mostly when a person experience maybe a negative effect, maybe a side effect happening as a result of the treatment that the person is receiving. All that you have to do is to let your healthcare personnel know so that something can be done about that. So you should be um, looking out for when they are giving you the medication or putting you on a specific drug. It will be discussed with you what the drug will do and then the possible effects you might experience. So when you experience that, it's then that you would have to let your practitioner know so that something can be done about that. So I would say all those are mostly considered. So you shouldn't have a lot of problem letting them know so that they would also help you out. But what would actually increase the rate of your recovery would be taking into consideration the diet. The diet. It is very, very, very important. Even if you are given a medication and you don't, the body doesn't have enough energy to process that medication, um, you'll still be having the problem. So diet it's through the diet that the body gets that nutrition, the energy to undergo all those healing activities. So the diet is very, very important. Then regular exercise, regular exercise that is also very, very important. Um, you could see that when someone suffers a stroke, mostly the functions of some of the body parts diminish. And so that would also be regained. The function would be regained through regular exercise, a well planned exercise. And then rest too comes into play. The individual has to have times of rest, effective times of rest to allow the body to process all that it is being put through. And then um, the individual should stay away from all those harmful substances we've talked about. And majorly, um, one great physician has said, healing starts with the brain. And so that positive attitude, positive mindset that the individual who has suffered the stroke would get towards healing would also play a very important role because it would boost his or her morale to get involved in his care. So having a positive mindset, and that also comes about when you have a reliable or trustworthy um, individual or being to support you. And so this is a good news for the um, those who are considered religious. If you have that positive mindset, that would also help you go along with the treatment regimen you are being placed on. And so, all I would say about the treatment is that just get yourself involved and let your healthcare practitioners know when there are effects that you think are not helping your body, and then something can be done about it. Thank you very much.
Thank you so much for this powerful explanation. You know what? From where we came from, that's how I'll put it. When someone get some condition, they will say, "Oh, when Kofi was in this state, oh, they bought this medication for them without consulting the medical professional or, for that matter, a doctor."
Sure.
What can you say about it? Because I sometimes I think about it. Even common when someone feels a bit of every condition start from something. It will either, maybe you might be having some if headache, or those are the common
Sure.
uh effects that it start from. But as soon as he heard that, oh, this my brother has stroke last month or last year, and he started by complaining of headache, and they went to buy this for him, and the doctor said we should buy this. So they start self-medicating them without any consultation, without knowing that every individual is different, without knowing that the consequences of every condition or the impact of every condition on individual's life is different. Therefore, everyone is being managed in a different way. What can you say about it, or how can you educate the public about this kind of, let me say, attitude? It tends to be a character because it's been something that has really been going on for quite some time now. So, what kind of education can you give it to our audience?
Okay. Thank you very much. This also brings to mind we would have to talk about some of the signs and symptoms of this conditions, so that when the individual experiences any of these, then caution will be taken, and then the very immediate action can also be um, taken. I would say that we should look out for these signs. These are the very common signs and symptoms of stroke, be it an ischemic, hemorrhagic, or the mini stroke. Mostly, um, the part of the brain that is affected due to the cessation of blood supply would, in correlation with the part of the body that brain part controls, would all together be affected. So, say if the left side of the brain is affected, the right side of the individual's body would also be affected. Mostly the limbs on that side, and then the muscles and their function would also be affected. And if the right side of the brain is affected, mostly the left side of the individual's body would also be affected. But you would see majorly the facial muscles losing their function, and so you might see that the individual's face will drop on one side. So the person may not be able to smile, or their mouth or their eye on one side would drop. That is a sign that should bring in question the uh, situation or condition of stroke. And then the arms and then the legs. The individual may find it difficult raising the arm or the leg, or maybe doing something with it. So there will be a weakness in the person's extremity. And then the person's speech may change. Um, he or she might have a slurred speech, or he'll maybe gabble, or the person may not be able to talk at all, despite the fact that they will be appearing awake. The individual may not be able to speak, or even if they speak, their speech will be slurred. And then they may also have problems understanding what is being said to them. So they might have problem processing what is being said to them. So they wouldn't be able to communicate effectively. When all these signs are seen, it means immediate action, urgent action needs to be taken. So if you are with someone and you see all this, then you can dial, in our situation, you have to dial 999 immediately, and then report, so that the quickest action could be taken. There are also different um, signs and symptoms. The individual may also be dizzy, confused, um, even the individual may even lose consciousness. And there are also lighter symptoms such as headache, resulting in a blinding pain. So the individual might have headache and then might say, well, he or she doesn't see clearly. So blurred vision can also be a symptom. So all these have to be considered. However, if any of this is experienced, the best practice would be to consult your health practitioner. You see, you might have maybe suffered any of these, uh, or you might have experienced any of these sign or symptom, and might have used a drug earlier to um, help you recuperate. However, the best thing you need to do is to talk to your practitioner, because each and every individual has a unique system. And though drugs are developed um, to help people go through specific health situations, however, how every individual reacts to a particular drug is different. How each individual reacts to a particular drug is very, very different, like unique. Let me use that word. It's unique. And so you have to talk to your health practitioner, who, through the series of assessments that has been done on you, can be able to put you onto the type of medication that would help you. And even if you would have side effects, it will be minimal, because assessment might have been done, you see, to know you better. Um, Blood tests would have been done to help the person put you on the very right drug that would not cause you so much harm. So I would advise that when any of these experiences, situations is felt or experienced, you would have to talk to your health care practitioner. That is the very best. Thank you very much.
Thank you so much, Mr. Oceans. Indeed, what you are giving us today is very, very paramount to our health. Therefore, when we take this advice, we will live longer, because health is life, but it depends on how you manage yourself as an individual, or how you manage your family, that will promote the whole family healthy lifestyle. At this moment, we will take a commercial break. I recommend to you, whoever is watching us, and even those who are not watching us at this moment, you can still cascade it to your family members, friends, and everyone within your community. Now, if you are sending money to Ghana, there is our one company that we are recommending to you is OAP Community Shield. Are you a church or an association looking to raise funds for your welfare? OAP has a deal for you. Your church, shop, restaurant, or association can get monthly donations from OAP if you and other members send money with OAP. Members will also get extra £5 on their first transfer. Use the promo code or coupon code REACHMORE. Contact us now to get started at info at oneafrica.io, or you can call us on this number. If you are calling from outside UK, it's 0044 or you can contact us on the info at oneafrica.io. There is no other money transfer that is better than you using OAP Community Shield. Please use this promo code RICHMO and you will be blessed. Your family members will receive the money as soon as it's being sent to you. Viewers, we thank you so much for how far you have been staying with us, listening to us right from Richmond Media Health Issues. Today's topic that we are discussing is diet and stroke. How does stroke affect the body? What are the causes, signs, and symptoms? Diet recommendation. What kind of role that diet plays in stroke if you have it? But if you haven't gotten it yet, how can you prevent yourself or preserve yourself from getting stroke? What are the right way? What can you do when you get stroke? Don't self-medicate. Contact them, healthcare professionals that will be able to conduct an assessment that suits you as an individual so that the right medication will be given to you to protect you or to prevent you from getting further implications. Because sometimes we take too long to contact the healthcare professionals. There are three ways or three forms of stroke. That is ischemic, hemorrhagic, and then TIA, the mini stroke. When you get this, how did they occur? By lack of blood supply to the tissues of the brain or an occlusion. That is when there is a clot that the blood is not being able to transport, because when the blood is being transported to the brain, then they get the nutrient. That's where oxygen also comes in, so that it will all be supplied to the rest or all the other parts of the body. If you wait too long for the blood to flow to where it's not supposed to be flowing through to, it's a big problem. Or if you wait too long when there is no supply of blood at all to the rest of the tissue, then you have a problem. So please don't wait. As soon as you see some of these signs that has been mentioned by Mr. OWUSU ANSAH, if you think that someone's speech is being changed, please act on it quickly. If someone is not talking the way or the normal way that a person is being communicated, please act instantly. Don't wait before it's too late, because the longer that you wait, the more complications that you get or you put your family member in by getting stroke. Act fast. Contact the healthcare professionals to save life, to prevent life, and also to give life to each and every one around us. It could even be you yourself, myself, as I'm talking. So, this topic that we have brought to you today from Richmond Media is not only for you, it's for both of us, it's for the whole community, it's for the whole country, it's for the whole world, because you are watching us from different countries. It could be in Africa, in Europe, in Asia, and from the USA as well, wherever, Australia, Canada, wherever that you are. I hope what we have given you today, you will take it upon, or you will take it on board in order to save life. At this moment, Miss Owusu, what are some of your recommendations that you can give to our viewers at this moment?
Okay, thank you. I would say you can significantly reduce your risk of having stroke if you eat well, you take regular exercise, and you abstain from harmful substances such as alcohol and nicotine. And you would have to ensure that you let your healthcare practitioner know um, think what is actually going on in your system so that they will be able to help you um, better. Don't self medicate, please. And you have to have a positive mindset whenever you have um, a problem in your body, health wise. If you have a problem, just have a positive mindset, and then after consulting your healthcare practitioner, you involve yourself in the plan that has been laid out for you. Thank you very much.
Thank you so much, Mr. Usansa, and thank you everyone for watching us this afternoon. Richmond Media bringing to you, or brought to you, health issues, diet, and stroke. We have seen, or we've heard what is going on within the zone of diet and stroke, how diet can help us prevent us from getting stroke, the amount of food that we need to eat, yeah, the nutrients that we need to have. We have to balance our diet in a proper way that will prevent us from getting stroke. And when we get stroke, what do we do? What can our family members help us in order not to get more complications, by helping us choosing the right diet, apart from what the professionals will be recommended? Because what is being recommended, we need to follow. But what are you doing to help your family member improve their lives from getting stroke, or when they are in stroke, by following what has been outlined, the recommendations that the healthcare professionals have put in place for that particular person? And if you follow it, you prevent more complications. And by the grace of God, I think you will be living a healthy life from then onwards. And if you haven't gotten that, you will continue to live a healthy life. Depending on which area that you are living, that will depend on the type of food or diet that you will be able to manage your health with. So today, even if we've heard nothing, we've heard that there are three forms of stroke: ischemic, hemorrhagic, and TIA. Whichever form that you get, or whichever form that it is get, let us live a healthy life, follow a healthy, balanced diet in order to prevent ourselves from it. And when we get it, don't wait too long to act. Act immediately, so that the right management can be put in place in order to get you out of it, or in order to manage you properly. Thank you so much for watching us this afternoon. At this moment, on behalf of Richmond Media, we express our condolences to Honorable Philip Atakakra Basua. At this moment on Monday, we heard the sad news from the Basua family. And Philip Basua, the senior, they are twins. So the senior is my brother. If I say a brother that I have in the UK, he is my number one brother. So if we have lost Kakra. I'm part of the family as well. So therefore, I express my condolences to the family here in the UK and in Kumawu, and to the NPP family, the Elephant family. We express our condolences to you all. Thank you so much for watching us. And next week, the same time, we bring to you health issues. Continue to watch Richmore Media from YouTube, Facebook, and listen to us on radio as well. Thank you so much. I had with me at the studio, Mr. OWUSU ANSAH. Thank you so much for coming, Mr. OWUSU ANSAH, and for opening your door to Richmore Media at all times. We really appreciate you. We salute you. We appreciate the fact that you have availed yourself to be used by God and also to be used by Richmore Media. Thank you so much, and may God bless you abundantly. And my name is no other person than Hanna Bimah. This way of spelling my name is a special way, so no one has this spelling. Both Hanna and Bimah. It's only me that has this name. And you can get me from nowhere, no other radio station, no other media than Richmore Media. Continue to watch us every Sunday, the same time. Thank you so much. Bye for now.